Yeah, we get direct referrals from the GP practice, so from acute soft tissue injuries, and we also get referrals from consultants round about it.
You will be with us?
Ladies and gentlemen, welcome to Wilmslow. Welcome to the new improved Wilmslow. It's lovely to see so many of you here and to see you all so well. Many faces here that we see from different aspects of our business and our professional lives. Welcome to friends and colleagues and staff, and associates and patients and to all of you. Thank you very much indeed for coming. I think one of the things we need to do today is to say thank you, and say thank you to the many people who have helped us with our extensive build and extensions over the past year. Some of our colleagues from the Primary Care Trust are around. I can't quite make... Oh, there they are. Well, thank you to Nikki and to Simon and all those at the PCT. And of course to the Co-op Pharmacy, who are extremely helpful in our developments, to our architects, and of course to our long-suffering staff and patients who put up with horrendous amounts of pile driving and mess for many months at a time. So thank you very much. I'm not going to speak for very long. I know that many of you are pressured for time. Thank you for George to coming along today in a very busy schedule as always. Just before I hand over to my colleague Amar Ahmed, point out that what we're trying to do here, what we're trying to achieve, is innovation. Innovation in terms of how we work and where we work and what we do. Mindful of a previous Chancellor who was shown around innovations quite a long time ago, in the days of Michael Faraday. Michael Faraday, who was one of the discoverers of the uses of electricity. Chancellor at that time, he may have been some such person as Walpole or one of those. I'm sure, George, is more up to date with political history than I. The Chancellor at that time, being shown round the laboratories by Faraday, was impressed by the various devices and machinery, which is very much in evidence, that he stopped the great scientist after some time and said, "It's very impressive, Mr. Faraday, but what possible use is it?" To which Michael Faraday replied, "Well, sir, there's every possibility you'll be able to tax it." May we soon have something to tax. Thank you.
Thanks, Mark. Ladies and gentlemen, thank you all so much for coming to our opening ceremony today.
Over the past year, our staff and our patients have been extremely resilient, enduring the disruption that comes with construction work. The dust, the noise, the rearranged clinics, the missed deadlines, the indiscreet builders. But finally, just yesterday, our last contractor left the site for the final time, and at last we have our much improved finished building. And I really want to thank the staff as well for putting up with the building work for so long. Now, these changes are really significant. Okay, we've created a bigger, better working environment and a care environment for our patients, but more importantly, we've created the opportunity to really improve patient care. Already Wilmslow Health Centre has been at the forefront of providing practice-based commission services, and we've been providing these now to patients across the North West for the past 3 years. But we'd like to do more, a lot more. And the recent extension and the proposed NHS reforms will allow us to do just that. Now, we're really excited about the government's health policy. It really is a breath of fresh air compared to what we faced as clinicians over the past few decades. Well, a decade. Feels like many decades. At last, we have a health secretary who actually listens. At last, we have a health policy that promotes innovation, a health policy that doesn't get in the way of patient care, and a policy that really does make sense and puts the emphasis back on the patient and not on the process. Through services like ours, the bottom line for the patient will be a faster diagnosis and prompt and efficient treatment delivered at a time and a place that suits the patient. I'll give you an example of how good things could be. Not so long ago, I had a patient who presented with a worrying lump. Because of the scan service that we've developed here, that patient received a scan within 2 hours of seeing me, and they were seeing their consultant to plan their further care and surgery within 24 hours. And best of all, it didn't actually cost the NHS more, because we were actually able to do that, all of that for the patient, at a price well below that of traditional service providers. So that's what we're trying to achieve here. A faster, convenient service at a reasonable price with absolutely no compromise on quality. And the completion of our operating theatre means that we will hopefully be able to expand the range of services that we offer to our patients by including further diagnostics and surgical procedures. So this was the easy bit. The year of building work and all the inconvenience it caused, that was the easy bit. We've got lots of projects in the pipeline and we can't wait to get clearance to start delivering them. That will be the most challenging bit. But the proposed NHS reforms are here for us, both clinicians and for patients, and we're confident that we'll finally be allowed to offer our patients even more, and we look forward to working with our various partners here today in delivering them in our new facilities. Finally, I'd like to introduce you to a man who you'll all recognise on the international and national stage, but today I'd like to introduce him as a great constituency MP who has done an immense amount of work sticking up for the people of Tatton and sticking up for the people of the North West. Ladies and gentlemen, George Osborne.
Well, thank you very much, Emma. Thank you for those very kind words. And when Emma invited me here, there were really 3 reasons why I said yes. The first was that I'm the MP for Wilmslow, and it's just great to see these additional health facilities here, and I think on behalf of everyone we should congratulate Mark and Emma for their vision in expanding this GP surgery. You've been really inspirational in doing that. Give them a round of applause. And I want to also thank all the other people who work here and the staff at the co-op over there, and some enlightened local government I've got got Councillor Crockett in front of me, but I understand, and I don't often get this as the local MP, there were no problems with the planning permission, which was great. And I know the PCT and the local hospital trust as well have been supportive, and that's great. And as I say, as a local MP, it's just fantastic knowing that the people I represent in this town, there are other surgeries here, but with this surgery, they've got a really fantastic facility on their doorstep. So that was the first reason I said yes. It's a good thing in my constituency. The second reason I said yes was because I'm part of a government that is undertaking health reforms which are really, I think, epitomised by what you see here. We are seeking to put the GPs with their patients in charge of choices in the NHS. We want to see more community services like the kind that you will offer here. We want to see the kind of ultrasound services, some of the potential surgery services that you offer here done here, so that actually the really acute care is done at the hospital. And the hospital, whether it's Macclesfield or some of the Manchester hospitals, are not clogged up with operations that frankly should be done right next to people's homes and can be done right next to people's homes. And also that the preventive work is done right here and the early scans are done here. And the health reforms, of course, some people are not entirely happy with them. But I think they do go with the direction that so much else of our life is going with, which is people being in charge of the things that affect them. And with the support of the GPs working here, I think patients are going to get an excellent choice. And so that, for me, is an advertisement for what we're trying to do across the NHS. So that's the second reason I said yes. And the third reason I said yes is very simple. I'm a patient here, he's my GP, and I want to stay on the right side of it. So for all those reasons, it is fantastic to be back here. This waiting room is transformed, having sat in one of these seats for a while, waiting to be treated. And I congratulate everyone who's been involved in this magnificent project. It is properly visionary. Thank you.
Bill? Where are you, Bill?
Well, first of all, I'd like to congratulate the health centre on not the wonderful building, but all the wonderful new facilities that we've got here. I too am a patient, so hopefully a good example of being a patient here, but well done, and we look forward to even better treatment if that is possible. George, Chancellor, thank you so much for coming along and doing the ceremony here. It's very meaningful to the centre and to all of us that you're doing that. And of course, finding time must have been very hard for you, but thank you so much for coming along. I remember when you were first elected as an MP for Chatham, we had a little lunch party given by dear old Patty in your honour to sort of launch you, and you were, after that dinner, setting off for London to take your seat for the first time. And I remember jokingly saying to you, don't start challenging for the leadership the minute you get there. Anyway, here you are, Chancellor of the Exchequer. Wonderful, wonderful, well done. I also want to just take this opportunity to say, I cannot get over the speed and efficiency with which you forged the coalition. I just thought that was truly amazing. And also, well done with what you're doing, tackling the economy, which we know there's a lot of difficult things to be done and hard times ahead, but we all know that, and we also all know it's in very good hands. I'd like to remind the health centre here that their top priority should be keeping the Chancellor fit and healthy so that he can carry on with the good work he's doing, and to let him know that we're all behind him. Thank you very much.
So I think there's going to be a buffet upstairs, so if you would like to make your way through this entrance over here up to the new education and training suite. Oh.
Yes? Okay. There we go. Right, now we can have a buffet.
Up to you guys.